pulmonary function test. Okay. To start, what is spirometry? Spirometry is a portion of the pulmonary function test where you have a patient take as big of a breath in as possible and then exhale that breath as quickly and as long as possible. This helps us figure out what the airflow is throughout the lungs and helps us determine if this patient has obstructive disease or restrictive disease. Where do the percent of predictive values come from? The reference values come from other patients who have similar age, height, sex, race, and ethnicity, and you want to see how they compare to other patients with the same demographics. Can you interpret the results on this test and tell me what type of lung disease this patient has? So this patient has a reduced forced vital capacity as well as a forced expiratory volume at 1 second, but what we're really looking at here is the ratio of those two, or the FEV1 over the FVC, and this patient has a reduced ratio of that. So that points more in the direction of restrictive disease. If you look at the total lung capacity, that's also greater than the predictive value, which fits the point of obstructive disease, whereas if this was a restrictive disease, the ratio of the FEV1 to FVC would be more normal, and the total lung capacity would be smaller than predicted. Lastly, what's a flow volume loop, and what do you think it would look like for this patient? A flow volume loop is a graphical representation of the spirometry. The x-axis is volume and the y-axis is flow. For patients with obstructive disease, you'll see a scooped out appearance of the expiratory phase because there's a slowdown of flow as the patients are breathing out.